here. I just
Okay.
advanced that so we can always post this and get it out to our other friends and constituents. So first, I want to again thank you, all three of you, for being here this evening. And what I'll do is I'll just kick it off to Krista first, and then Eric, and then Sarah. And if you would just, when you open up your discussion, just give us a short little background of yourselves and kind of where you came from and how you got to where you are. And then we'll continue to hear about your bill. So Krista, you want to kick us off?
I'd love to. Thank you. Thank you, Mike. Thank you, everybody, for being here tonight and for having me in your community for this meeting. It means a lot to me, especially to address the faith community on an issue that I really believe goes to the heart of faith and morality and justice. But before I talk about the bill, I'll tell you a little bit about me. Many of you, or some of you, might be my constituents already. I know Roger and Sandy are, and some of you may become my constituents in November when we redistrict. So I'm the state rep from the 12th district, and that now currently includes about half of Hockessin, 90% of Greenville, and about 25% of North Wilmington. It's east, starts east in Fairfax, goes all the way to Limestone Road in Hockessin. South, it goes to 141, and north all the way to the state line in Pennsylvania. So geographically, a very large district. My background is that I'm an attorney, not currently practicing because I'm parked, so I'm not driving now. So no, don't think that I'm doing anything illegal here. So I'm an attorney, but not practicing now, so that I can dedicate my time to this legislative job that I have, as well as two of my kids, one of whom has special needs. He has Down syndrome, and I have a rising 9th grader. So they keep me busy. And essentially what caused me to run for office was when my little guy, who's now 7 and a first grader, was 1. He was diagnosed with leukemia and spent a good deal of time, 6 months, we lived at the Moors while he underwent treatment. And my background as an attorney led me to come to the resolution that I felt like I needed to run for office to really shape some policy decisions. Prior to that time, I worked on family justice issues, specifically child abuse, elder abuse, and domestic violence. And I also represented the kids department, so I dealt with children in the foster care system. But I didn't want to, when Nate, my little guy, got better, I didn't want to really return to that revolving door that I felt I experienced at the Department of Justice. It was a great job and a great career, but there's only so much that one can do on some of those issues. So I wanted to use my experience to make a difference in shaping policy that would hopefully reduce the cases that go through the court system, which really my goal is to reduce the amount of families that have to go through pain and suffering. So that was my lofty goal for why I ran for office, and why House Bill 317 is so near and dear to my heart, and why it's so near and dear to my heart also because of the tremendous co-prime I have in Senator McBRIDE. Both of us have deeply personal experiences with loved ones facing cancer and the treatment and care that they received. From my perspective, as a mom, I was extremely fortunate. It sounds funny to say that you're fortunate to have a child with acute myeloid leukemia, but my son is alive today because he was afforded the ability to be treated and tested very early on by his doctors, so that we were able to diagnose and treat his cancer very immediately. You know, he went through 6 months of grueling treatments that nearly killed him, but he's alive today because of the early detection that we were able to receive because he was routinely seeing doctors. For about 5,000 children in Delaware, that is not the case. Children who are undocumented do not receive preventative or routine care because they do not have access to medical resources, because they don't have the insurance or the ability to pay for the services. So what my bill, and why I'm here with you to talk to you about that and see if you have any questions and ask for your support, is for House Bill 317, which creates an insurance type program for these children through the state of Delaware. It requires the Department of Health and Social Services to create an insurance program similar to CHIP or Medicaid for those children whose families meet those low income thresholds. So there are about 5,000 children in Delaware who are undocumented. Approximately 2,500 of those would be income eligible. Sadly, because so many of these children and their families face fear of deportation, we know that many of them would not seek out or receive the services. But for those who do, we would be able to give them labs, tests, routine appointments, vaccination, medication, and all of the things that you think about. If you have kids or are an aunt or an uncle, you know that kids experience such a wide array of health issues. Be it like a small ear infection to falls and injuries to cancer. So what we're trying to do is really bring justice to children who are here in our state. They go to school in our schools and they live in our community, but yet they don't and aren't able to get access to doctors. So I'm really excited for this legislation. It's been a big bill. It's been a big process. We have a wonderfully strong coalition of bright and talented and diverse people who are so dedicated and passionate about helping these children. So right now, where it stands is it was released from the Health Committee in the House. It does now face its biggest hurdle. And that hurdle is to be funded by our Joint Finance Committee, which begins its deliberations on all fiscal matters next week. So I know I've talked a lot at you, and I don't like to do that. So I want to hear from you and see if you have any questions about the bill. And I know Senator McBRIDE has a lot to say about it too, as she's equally passionate to trying to get this accomplished.
Thank you for that, Krista. And Sarah, do you want to go ahead and just add on, and then we'll ask questions of you both?
Sure, absolutely. And it's good to see everyone. So Krista and Eric, this is actually my faith community. I am a lifelong member of Westminster. And so a lot of the folks on this Zoom I've known my entire life, and grew up with them or their kids. And so I am really excited to be back. Also, I wanted to say before I speak to HB 317, which is a top priority for me as the Senate Prime, that I am grateful to this group for your support and advocacy on Senate Bill 1, the Paid Family and Medical Leave Bill, which, as I'm sure many of you saw just last week, Governor Carney signed into law, making Delaware the 12th state, including DC, with a paid family and medical leave insurance program. It is the single largest expansion of the social safety net in modern Delaware history. And that was only possible because there was this coalition, this broad coalition of Delawareans and of organizations that lifted their voices to make it possible. And so I am incredibly grateful to the Peace and Justice Group for being a part of that coalition and getting that bill over the finish line. And when I ran for office, I said I wanted to be the healthcare senator and the paid leave senator. And so this bill really is, for me, that second priority for this legislative session. And I'm so proud to be the Senate Prime. Representative Griffith has done an exceptional job as the prime sponsor of this legislation. Watching her work on it is a real pleasure. She works with such a thoughtfulness and a grace, and it's one of the reasons why this bill really has a lot of momentum behind it and strong chance of moving forward. And actually, I'm huge fans of both the representatives on this Zoom. Eric, Morrison, and I just spent a really fun week together, actually, in the Caribbean with our other colleagues, Senator Pinckney and Representative Bombach. But Representative Morrison and I are co-chairs of the LGBT Equality Caucus, and really have a great opportunity often to work together. So legislators, whenever they're on a Zoom, they have to get on and fawn over each other. So I just want to Eric and I both did get really bad sun poisoning. I think mine might have been worse, Eric, because I molted entirely, although you did too. But I think I might have gotten it a little bit worse.
I don't know. Did you have blisters on your bald head?
I had blisters on my head, and
did
not my
you?
bald head. No bald head blisters, but I did have blistering here.
Yeah, it
and
was
here,
bad.
and had fever-like symptoms the first night. But anyway, so in all seriousness, to build off of what Krista was talking about, the moral case for this legislation, I think, couldn't be clearer. For me, one of the guiding principles in my philosophy and ideology is the Hubert Humphrey quote that the moral measure of a society is how we treat those in the dawn of their lives, how we treat those in the twilight of their lives, and how we treat those in the margins of life. And this legislation really touches on each one of those areas. And I think it goes directly to who we are as a state of neighbors, something that we like to pride ourselves on here in Delaware. And that state of neighbors, that comes with a neighborly duty to care. And when you see someone, particularly a kid, who needs help, you don't ask for their documentation. You don't ask where their family was born. You don't ask where they were born. You just go and help. And that's exactly what this bill does. It provides a necessary lifeline for young people in being able to access the critical care that they need to live and to thrive. These kids didn't choose where they were born. They didn't choose the family that they were born into. And they need healthcare just like everyone else. And so this legislation would certainly advance that principle and those values, but it's also not just compassionate policy, it's smart policy. As the chair of the Senate Health Committee, I see very clearly, and many of you know this, that smart healthcare spending is early spending. And these young people, they're able to get care. They are able to get care in emergency rooms. They're able to get intensive inpatient care at a cost to taxpayers, at a cost to hospitals that get passed on to ratepayers and the insurance and who pay insurance. And that is particularly inefficient spending because we're spending money at the point of greatest sickness and need, rather than spending money more wisely and getting these young people connected to routine and preventative care, to keep them healthy on the front end, not just to improve outcomes for these young people, but also to help save costs for our overall healthcare system that eventually we end up saving as well as taxpayers and as insurance consumers. And so it just makes good financial sense to provide this critical care to young people, to provide this coverage so that they can get that routine and preventative care to keep them healthy and to keep costs down. And in addition to the preventative care, there's a story that I think Representative Griffith and I both were told by some friends of ours in the hospital industry, some friends of ours who are providers at Nemours, where they are treating a young person, just particularly tragic example. So this legislation would certainly help to ensure access to preventative and routine treatment. But this one story, I think, really was a motivator for me in wanting to champion this bill. And it was the story of a young person that Nemours is treating who is dying, who has a slow-moving terminal illness that will take this child's life. And most children, every child in the state, except for undocumented children, are able to get coverage for the home care that they would need in this circumstance. Now, these young people could access hospice, but they are not, this young person could access hospice, but they are not yet in a condition that would qualify them for hospice. But they are in a condition where they would need that kind of outpatient and or home care. And the sad reality is, because the way the system works, this child who is dying, the only way to get the care that they need in this palliative care that they need in this current state is to be essentially inpatient at this hospital. And that is taking this terminally ill child away from their parents, away from their family, and is resulting in a quality of life in the very precious time that they have left that is cruel and harmful to not just their physical health, but their mental health. To me, that is unconscionable, that we have holes in a system that result in a terminally ill child essentially being ripped away from their parents and their family. And this bill would change that. And I think, if we are looking at these circumstances, if we're hearing these stories, and yes, it requires some level of investment, but we've just got to put our money where our mouth is. We've got to invest in these young people. They deserve it. Our state deserves it. And I think we deserve it, so that we can look ourselves in the eye and know that we're doing right by these young people, that we're living up to our values as a state of neighbors. And so I'm really hopeful that we can get this over the finish line this year. And if we don't, we'll keep on fighting. But I am really hopeful with Representative Griffith's leadership that we can make progress.
Well, thank you, Sarah, for enlightening us on the issues. I guess I'll just start off with a question and open it up to anybody else. The one thing that our church is committed to is a number of support issues and bills that are hopefully being released. But we're all fundamentally struck by the funding issue. And I guess what is your early perceptions on the ability to get that done, and if there's anything that we as a group can do to increase that percentage?
Well, you ask very timely and great questions, Mike. Thank you. So actually late this afternoon, maybe within the last 2 hours, an amendment to the bill was filed to reduce the fiscal note. As a real, when you do legislation, you see this landscape in front of you that's limitless. And as you travel further down your path, it starts to get, your path starts to get smaller and smaller, and you really see that you need to make some alterations to get to your destination. And so unfortunately the original plan was to be able to cover everybody, and the fiscal note that was put on that bill set a cost in our real first full year of the program at $7 million. So when that note came out, you test, you figure out the temperature of the folks and the General Assembly to see how they feel about that kind of expense. And it's not just the folks in the General Assembly, that we have a governor too. And you have to look to see, is that note gonna present a problem for going forward? And our team really believed that it would. So we looked then at what's our next option? What can we next do that will be effective? And Nemours has an incredible policy team that has been very passionate about this issue for a long time and has a lot of data. So I had that individual really work with the numbers so that we could figure out how to best serve this community, knowing, of course, that there's going to be very slow enrollment here because, again, as I said, this population is very difficult. They're difficult in the terms of reaching them and getting them to come forward because they have real fears of negative consequences for seeking that care. So we know that there won't be, unfortunately, dozens coming forward to receive care. I wish they all would. So what we did was we based a fiscal note, and we're setting caps in the first year and in the second year and then the third year, and that will give the program time to slowly add children for these services. And it also requires that the department utilize a wait list if need be. So we're trying to build up to 800, cover 800 by year 2 or 3. Now, of course, our hope is if we get that funding in the first year, we can keep going back every year. And as the state and as my colleagues become more comfortable with the program, then we can fully fund within a year or two. So right now, an amendment on the bill was filed this afternoon. It was filed this afternoon because I wanted that in the hands of the Joint Finance Committee so that they can look at this and really give some deep consideration to this legislation. Otherwise, I think they would have, my personal view on it, and maybe I'm wrong, but we have to make decisions as legislators to what is our path and how are we going to get something done. So I did make the decision with my team, including Senator McBRIDE, to put a cap on it for 3 years so that we can at least get this started and then go from there.
Oh, great. Thank you for that information. I guess the next question, just to follow up, would be if there seems to be any halts or more discussion around these caps and the funding, is there something we can do, whether it's a call or an email or letters to the right people, just to push some of these things forward?
I think that would be very helpful. I think a personal outreach and email to the members of the Joint Finance Committee, and certainly I can get that information to you, in terms of who they are and just, why, it doesn't have to be lengthy, but just a couple of sentences or paragraphs or whatever you feel comfortable with, expressing your support and why you support it and why it's important, would be wonderful. And, right now our hurdle is with the Joint Finance Committee, and I think that if we have this funded, I can tell you this, and this is we should feel very good about this. This bill has a lot of sponsors, and that to me is so significant. People were not afraid to put their names on this legislation. As immigration issues are so, bring such negative connotations up in this country, and people get really reactive and reactionary. I will say that I've been very heartened to hear and to see so many people coming forward and sponsoring the bill and telling me, well, I'm not going to put my name on it, but you have my vote, and pledging that to me. So I do believe that I have the votes in my caucus, if it's funded, to get this passed. And that's not an easy lift for a bill like this. And so I'm very happy to hear that. We just really need to make sure it's funded. That's our big hurdle.
Great. Okay, thank you. Anybody else have questions for either Krista or Sarah?
Just to whom should we address any correspondence? Who are the key people here? And what's the next actual legislative hurdle?
So the people are those members of the Joint Finance Committee. So I will get that information to you so that you have it. And we're right now, next week, they roll up their sleeves, this committee, and they hammer out the budget. They go through not just this bill. So, this bill competes with a lot of other priorities. And so if it doesn't get funded this year, it's not, it just needs, it's just going to determine where it falls in the priority list, because there's, for example, and this is what we all have to keep in mind, direct support professionals have never been paid at the rate they're supposed to be paid. We're looking at trying to help our childcare providers and parents afford childcare. So there's a lot of competing priorities. But to me, particularly since we put this cap, which I think is really reasonable, I think we've done a really good job in showing that, this is something that we can afford as a state, and here's how we're going to afford it, and this is the path that we're going to take. So I'm hoping that will help us get over the hurdle and compete with the other priorities.
I would guess that most of the parents are working somewhere. That's why they're here, and they are working for the state somehow. They're working for us. They're working for industry. They're working somewhere.
And they're paying taxes. I think that people often forget that. So that's it in a nutshell.
Okay. Anyone else? Okay, well, let's move on to Eric Morrison, who's going to give us some detail around the bill HB 354. And Eric, if you would jump on in, give us a little background, and then tell us about your initiatives.
Sure. Well, first of all, thank you everyone for having me here today. I appreciate this. It's always nice to be invited, excuse me, to talk about a piece of legislation you've worked hard on. A little bit about myself. I am Representative Eric Morrison, and I represent the 27th District, which is in the Newark, Bear, Glasgow area. I personally live in Glasgow area, almost to the Elkton, Maryland line. And then with redistricting, I will actually be picking up a little bit of Middletown. So I'm going to have quite a spread out and diverse district. I'm looking forward to that. And I want to thank Representative Griffith and Senator McBRIDE on the work they're doing on that bill. That is such a wonderful bill, and I'm happy to be listed as a co-sponsor on there. So this piece of legislation is what it does is it's regarding Delaware's Whistleblower Protection Act. And a lot of us are probably familiar with it, but basically the whole point of that act is to encourage and to make it so that employers cannot penalize employees for blowing the whistle on their employers, whatever that means. A lot of us take for granted safe working conditions, for example. Not everyone has safe working conditions. A lot of us take for granted that the work that we do, we're going to get paid for and paid in a timely manner. Not everyone can take that for granted. There are rising incidents of wage theft. There are rising incidents of employees not being paid properly for overtime. There are rising incidents of unsafe workplaces. And these, unfortunately, a lot of times tend to disproportionately affect our undocumented brothers and sisters, or individuals who are perceived as perhaps undocumented. So what this does is it amends the Delaware Whistleblower Protection Act to preclude an employer from reporting or threatening to report an employee's suspected or actual citizenship or immigration status, or a family member's suspected or actual citizenship or immigration status, to a federal, state, or local agency in response to the employee blowing the whistle on their employer. I originally happened to stumble across an article about how Rhode Island did this last year. And I thought, yeah, I like this. And I think this is an important thing. So I did some reading and some research on it. I also confirmed with House lawyers that the way the Whistleblowers Protection Act is written right now, this is not necessarily implied to be a protection that's listed. So this is not something that's out there. So we're not even just calling this out specifically. It's likely that we're adding this as a specific protection. We want to ensure that all workers feel protected in terms of reporting employers' misconduct. And again, that can include wage theft, safety hazards, and fraud without the fear of retaliation. Studies and personal testimony from across the nation support the fact that unfortunately there are some malicious employers who wield the threat of deportation as a powerful weapon to abuse their employees and to freely break the law. In fact, there are employers who specifically hire undocumented immigrants, at least in part, because they know that they are often afraid to blow the whistle on their employers, and so they can take advantage of them. Across America, labor union reps and labor law enforcement agencies, community-based work centers have reported that there are workers who are victims of or witnesses to employee misconduct who are unwilling to cooperate or to talk about their mistreatment because they fear that their employer will report them to an immigration enforcement agency, even if they are a legal immigrant resident. And sometimes that also extends to fear for their families. So I think that Delaware should recognize that these threats are here, that they're real, and that we should recognize them in the same way that we treat other abuses that are used to keep workers from reporting workplace violations. It's also important to keep in mind that this legislation isn't just about undocumented workers or workers who may be perceived to be undocumented, but it actually helps all of Delaware workers. The more encouragement we have for any employee to come forth and report an employer who is having unsafe work conditions or practicing wage theft or what have you, the better that makes it for all workers. We want those issues reported. And actually, this issue has even been recognized at the federal level, and the Biden administration is considering extending deportation protections to undocumented immigrants if they report an abusive employer. So I think the time is right for this legislation. It's not huge legislation per se. I have some huge legislation going on, but I'm just really passionate about this. I think it's important. I think it's an important layer of protection. I also think it helps all of Delaware workers. So that's really why I brought this legislation forward.
Well, great, thank you. Yeah, I was going to ask the connection to bring this to you, and then for you to take steps to try to initiate this bill. I mean, were you involved with companies or individuals that came to you, or how did it all start?
Right. No, I wasn't. I read a lot, and not that I have a lot of time to read, but I really kind of geek out on going through and seeing what other laws are being passed around the country. I think, there are a lot of good ideas that come up that we may want to replicate. And I just happened to stumble across the fact that they had done this in Rhode Island, and the headline caught my eye, did some digging into their legislation, then started doing some research about, the studies and the personal testimonials from across the country, and realized that this is a very real issue. And the sad part is we probably only know the tip of the iceberg, because if these employees are too scared to whistleblow on their employers, and they don't even have those protections, then what are the chances that they're out there reporting it to labor law enforcement officers or community centers or the media? So I think that what we do know is just the tip of the iceberg.
Sure, thank you. Any other questions for Eric?
I just did have a comment. I had an employee who worked for me, and then we parted ways. He went with another company, but he decided to he decided to notify OSHA of his working conditions, but only because he knew he was leaving that company. Because I don't know whether he thought it would just be untenable for him to stay in that company after notifying OSHA or requesting OSHA come in and pay that company a visit, which they did, and they did impose a bunch of fines. But he was just figuring that if he blew the whistle, he was gone. So he waited until he was ready to leave, and then called him in. So it's a very, very real thing, that even if you think that the employer might not might let it pass, but you also have to deal with your fellow employees, and that's another story. So that's just workplace dynamics that you have to deal with. But it does take some bravery to do this. It really does. So it's commendable that you can reward a little bit of bravery with a little bit of protection as well.
Yeah, and thank you for sharing that. And I think, and this made me think of that when you were speaking, that I think this bill also is about worker solidarity, which, I'm a very big believer in. And this sends a message, and hopefully, sends a message that, look, we're all in the same boat, undocumented, documented, whatever race, religion, sexual orientation, whatever level of socioeconomic status we are, that we're all in the same boat of facing the possibility that our employers can abuse us in a variety of ways. And of course, that's especially prominent for, people on the lower socioeconomic end of the spectrum, for people of color, and for, especially undocumented workers. But I think this is also kind of a workers' solidarity bill.
Sally.
Morrison, I'm really glad that you stumbled on this from Rhode Island and have introduced it in Delaware. Just really, really, really sounds like the right thing to do. And I'm wondering, hopefully it passes. And I'm wondering how the state would get the word out to undocumented workers.
Yeah. And that's a good question too. I've been working with some of the some stakeholders essentially in Delaware who will help me get the word out about this. And I'll be honest, I had talked to the Department of Labor about this, and and I'm trying to remember the conversation now, but essentially anywhere where this is posted now or where this is out there now, or, you know, whether it be on a website or anywhere, that all would be updated. But I also do want to work with stakeholders, whether it be the Latin American Community Center or different activist groups, that once this is passed, to help get the word out about this.
Great, thank you.
Any other questions? Okay, well, I'll just add to the fact that our Peace and Justice Work Group is handling a number of different issues around the environment, obviously around social justice issues, police reform, fees and fines, working with some of the local organizations that are involved in a lot of these things. So bringing these two bills to our attention is something we can pass not only through our 45 members of this group, but certainly the 350 active members of our church, but then also our connections we have in the community. So as you guys come across the needs to bring this legislation to the forefront and get it passed, if there's any activities that we can do, whether it's letter writing or emails or making phone calls, whatever, to help pass these issues, I'm sure you'd get quite a large group of influencers who would try their best to support you. So if there's no other questions, certainly we want to thank you again for bringing these two bills to our attention. Yes, Sally?
See Sarah.
Sarah?
All right, I actually just had a quick question. Eric, I don't know how I missed this when you circulated it for co-sponsorship. So with your permission, I'd like to be added as a co-sponsor, and I will email Rich Puffer to know if that's all right.
Absolutely. Thank you very much.
So sorry about that.
I won't hold it against you.
And
I think, Eric, I'm on the bill, so I'm pretty sure I signed on, and if I didn't,
Okay, thank you.
And I would like to add to Representatives Griffith and Morrison and Senator McBRIDE, huge thanks for advancing these important moral issues. Thank you.
Thank you. All righty. Well, with that, typically we last an hour, but with the effectiveness of your speeches and the background that you brought to us, we were able to finish even earlier. So we did record it. So again, a number of our members will be able to listen and follow up on this. And if there's any questions, we know how to get back in touch with you. So again, Sarah, Eric, and Krista, thank you very much.
Thank you so much.
All right.
Thank you for having me.
Thank you.
Great evening.
Bye.
thank you, everybody.
Bye.
Thank you.
Take care.
Bye.